Good afternoon and welcome to CATAnetTV. This is the Mobile Health channel. I'm David Farnes, the Mobile Health Lead at the Canadian Advanced Technology Alliance. Joining me today is Malekshahi, who is President and CEO of ConnecTek Inc. And we're here today to talk about eSignature, electronic signatures, and the various solutions in market, and some of the enablers that are out there bringing this solution to market. So Alex, welcome. Thank you for joining us.
Thank you, David.
So why don't we begin, Alex, and just maybe introduce yourself to the audience and tell us a little bit about ConnecTek.
Thank you, David. Yes, my name is Malekshahi. I am President and CEO of ConnecTek. ConnecTek is a software solution provider, and we have this electronic signature from a European solution provider called Sizmo. They have been in business for so many years, and they have a very good electronic signature and one of the best in the market currently.
Excellent. And so tell us a little bit about what electronic signature is and some of the applications.
Yes, electronic signature or e-signature is a general term. People use it interchangeably with digital signature, but what we refer to electronic signature is the ability to sign paperless. So you know that in the market today, when you need to sign, if you want to sign it on paper and you need to send it to somebody, if it's an agreement or a contract, what you do is you print that document, you receive it in the mail, you print the document, you sign it on paper, and then you scan it back into the computer, and then you send it over. If you have electronic signature technology, what you can do is just to, sign on your computer. If you have a tablet or you have one of those, touch screen devices, or even on your mobile device like iPhone or Android, iPad, you can sign using the stylus pen or simply using your finger, and your signature gets injected into the PDF document along with the signature image that we inject into the PDF document. We also include the biometric information of your signature into the document and encrypt them. By biometric information, I mean the pressure, the speed, and the acceleration, and different kind of biometric information we have. We encrypt them and we put it behind the image of your signature in the PDF document.
Now, you had me play with this a little bit, and I have to admit it's a lot easier, more convenient to sign something on my smartphone or my tablet as opposed to printing a document, signing it, trying to scan it again, having my printer jam, and so forth.
Exactly.
But yet, some people think that the PDF approach is more secure, but really, with all of the biometric and other information that you're loading in on top of the signature, the e-signature solution really is a more secure approach, isn't it?
It is. So the way it works is that we, as I said, we encrypt everything. We encrypt the biometric information of the signature into the PDF document, and as soon as somebody tries to alter the document, alter that PDF document, the signature will be automatically invalidated. If you use Adobe Reader on top of the screen, you will see that it will say the document has been altered since the last signature was applied. And if you look at the properties of the signature, you will see that signature is not valid anymore. So Adobe Acrobat Reader will tell you directly that something happened to this document and is not valid anymore, which is much more secure than paper. We know how much the paper-based signatures can be forged.
So who's using the solution now, and how easy is it for a company to adopt the e-signature solution?
We have many different client base in all different sectors and industries. Um, the main application of eSignature is with the software solution providers. Software solution providers come to us and ask us for integration of our technology into theirs. So, for example, a SaaS-based solution provider can use our web services that we provide to them and integrate eSignature into their technology. So using this, when customers want to sign a document, they simply call our web services and we come into the foreground and use the signature technology that we have. Customers can sign the document. That signed document will then be transferred automatically to the main server where all the signed documents are stored.
Excellent. So
And,
pretty
and the whole
straightforward integration.
communication is encrypted.
Gotcha. So it's a pretty straightforward integration for companies wanting to use it.
It's very straight, easy, and well-documented integration.
So, of course, on this channel, we like to explore mobile health, healthcare applications, and this is a solution that could be used in healthcare. What what do you see the benefits in the healthcare sector, and what's your experience been like bringing the service to market?
Like any other industry, healthcare specifically uses a lot of papers, and archiving papers, the cost of printing the papers, toners, printers, and everything, we know they will skyrocket. And archiving requirements, it like many years now. So in order to change all this, healthcare industry can use electronic signature to replace papers. Any document, any charts, customers' information, consents, and so on and so forth, all the agreements, you name it, they can be replaced by PDF version of those documents. Form PDF versions when users can enter information, first name, last name, and so on and so forth. And then using any device, iPad, for example, can be one of the best mobile devices, or Android. Users can sign electronically directly on the iPad or Android tablets, for example. And those documents, the PDF document, the signed versions of those documents, can be automatically stored somewhere that is compliant with all the requirements and regulations. And it has been done in the past. It's very easy to do.
So in a sense, a doctor could issue his orders and sign a form issuing the orders, or perhaps authorize a prescription that the pharmacist would receive, and she would then fill the prescription.
Exactly. So first, it will start with a new patient's information form that they will pass you a piece of paper and you enter your information. It can be electronic version. You simply pass an iPad or Android tablet to patient. They enter the information and they sign, and the PDF document will be automatically stored on doctor's server. And then after that, doctors, when they can see the PDF document, they even can prescribe and apply their signature if they want, and the whole rest of the process can continue. And in hospitals as well, the whole chart and everything can be electronic version.
Well, I imagine there's quite a demand for this type of solution. And before we went on air, we were talking a little bit about some of the regulatory or legislative barriers. Maybe we can just touch on that. What type of barriers are you encountering as you bring the solution?
There are still cases that some of the forms, some of the signatures on those forms require wet signatures, and that's something that is being discussed with the government. There are people who are looking after this, lobbying about it, and maybe we can use your help in approaching government and trying to overcome this barrier.
Well, we would certainly be interested in helping, and perhaps the call to action from from this hangout is for other companies that are encountering similar issues with respect to e-signatures and the use of e-signatures in Canada. Maybe contact us here at CATA. You can certainly contact me, and we'll help form a group to try to tackle that barrier.
Sure. And just to have some background about this, the E-commerce Act 2000 specifically says that any kind of electronic signature has the same validity as paper-based signatures. So that's been well documented, and the Act is there. It's just some of the very sensitive forms require wet signatures that can still be worked on, and as you said, we can work together to resolve this issue. But just this is very minimal number of forms and signatures comparing to the whole other forms, and I would say somewhere around like 5 or maximum 2-3% are those wet signature requirements.
Well, Alex, very interesting technology, a solution. I think that it's obvious to most of us the benefits of e-signature out there in the marketplace, in the healthcare application and other verticals. So thank you very much for joining us today.
Thank you very much. Thank you for having me. I will communicate the links that people can go. I will invite everyone to go and try it. It's free of charge. On your PC, on your mobile device, you can install it and you can try it free of charge. Our Android version of mobile device was introduced as #1 tool that a salesperson should have on their toolbox. So that's very good to have, and to try it.
Excellent, and we'll make sure that those links are available to the viewers. So for now, it's David Farnes, Mobile Health Lead at the Canadian Advanced Technology Alliance, signing off for CATAnetTV. Thanks for joining us.
Thank you.